brief voiceover will discuss the differences in the pediatric musculoskeletal system. So first, in terms of bones, the primary centers for bone formation are nearly complete in their development by birth. Remember that there is still a fibrous membrane that's still between the cranial bones that make up the fontanelles. As another reminder, the posterior fontanelle closes between 2 to 3 months, and the anterior fontanelle closes between 12 and 18 months. So the epiphyses are the ends of long bones, and they remain cartilaginous after birth. The bone continues to grow until we are about the age of 20, when maturation for the skeletal system reaches completion. And long bones in the child are porous and much less dense, and therefore their bones can bend and buckle or break as a result of a simple fall. So because they are not fully developed and ossified, that makes these bones that much more fragile. It is imperative that we teach families about calcium intake during childhood and adolescence, because it will provide for the adequate bone density that we need these kids to have. It will lead to preventing osteoporosis and fractures in adulthood, so it'll contribute to that. Because bone growth occurs at the epiphyseal plates, though, injuries to that portion of the long bones are very concerning in young children. That's the space where the growing is beginning. That's the ends of those bones that are very cartilaginous, and that is damage to those can be concerning for long-term growth. The functional differences in the bones of children and adults also is a big difference. Before birth, the thoracic and sacral regions of the spine are convex. And then as the infant begins to learn to hold up its head, the cervical region becomes more concave. And then as the child learns to stand, the lumbar region becomes concave. So that development has to take place in that order. And if it does not, curves result in abnormal spots, and we get like a kyphosis or a lordosis in the spine. The rapid bone growth of children facilitates really fast healing after fractures, but what you often hear families and children talk about are growing pains. And that's because the muscles are pulling on those bones as they grow quickly. So that makes it a little more painful when they go through their growth spurts at various different times of development. There are some differences in muscles and tendons as well in children. So first of all, the musculoskeletal system is pretty much developed at birth, and then muscles will just simply increase in their length and circumference. We're not going to get more muscles, we're just simply going to get longer and bulkier muscles. Until puberty, ligaments and tendons are much stronger than bone. And it's important that we pay attention to this, because sometimes broken bones can be misdiagnosed as a sprain, and a sprain is a tearing of ligaments. Remember that ligaments are the structural support connecting bones, and usually are caused, a sprain is usually caused by a joint that is twisted or otherwise traumatized. So we need to be aware that just because they're stronger doesn't mean that the child doesn't have an underlying fracture or break. Additionally, tendons, which connect the bones to the muscles, grow in length and fibrous tissue when pressure is placed on them. So with weight-bearing activity, those tendons will improve and grow. So once again, it's important to remember that ligaments and tendons are much stronger than bone up until about puberty, when there are a whole lot of other changes taking place in the body. So it's important that we recognize those differences so that we are diagnosing these children properly with injury. And finally, how do we assess the musculoskeletal system of an infant or a child? And this should be a review, but with regards to muscles, we are looking for where those muscles are. Is it bilaterally equal? Is the mass symmetrical? What are their fine and gross motor skills, and are they corresponding appropriately with the growth and development of the child? Is the child weak in one area or not? Joints, do we have full range of motion? Is there crepitus noticed in those joints? Is pain noticed with joints? Is there symmetry in the range of motion of joints? Bones, are the arms and legs the same length? Has there been a change in mobility for the child? Are bones aligned, and is the spine in alignment? And finally, with regards to tendons and ligaments, is there pain noted when the joints are moved? Is there crepitus or grinding in those joints? And what sports or activities is the child involved in? Because certainly we want to see if that in any way puts the child at risk for compromise.